Number 3 of the Essential 7 is production and adjusted production. And the reason I distinguish between the two of these is that, first of all, most fees when they're posted are not posted at the full UCR, usual customary fee that the doctor would charge. They're posted at, if someone's on a contracted program, at that lesser fee. So what we're not able to see if you're not posting production, gross production, is the difference of what it's costing you to be on different contracted programs, or to give your hairstylist best friend a free crown, or
Sure,
implant, whatever that might be. So these numbers are the numbers that I see so overlooked in practices.
Now, I don't work within practices like this, at this level. Is this something they really don't know? Surprises me. Or that they don't pay close enough attention?
Well, it's two things. Don't pay close enough attention, or how are they, if they're looking at the number, how do they assess if that number is positive or negative? So I always establish an annual plan with goal figures. What do they need to produce? What is gross and adjusted production to be able to cover all the practice expenses as well as their personal expenses?
Okay.
So too many times doctors will look at a situation and say, you know what, the chairs are full. And when I hear that assessment of the chairs are full, it all must be good, it makes me crazy, because
You hear that a lot.
I hear that too frequently. Because chairs full, rear ends in the chairs, does not mean that the practice is humming necessarily.
You think that's a defensive statement to you sometimes? Like, well, the chairs are full.
I do, because, and I understand this, I'm a businesswoman, I have my own business. It's hard to have someone look at your own business, and that's why I look at this, again, without judgment. But it's doctor, if you're not looking at this number, you are opening yourself up to all types of problems.
Okay.
And more difficulty at correcting or turning the ship around. So what I do to correct this is, first of all, we establish a goal amount. What needs to be produced? What's your gross production? What's your net production? What do you need to collect to cover all the expenses? And that's an easy process. I can take doctors through that in a couple of hours, so that they know it's not just looking and saying my chairs are full, it's looking at the numbers and saying,
Okay,
I am achieving those production goals that will allow me to comfortably cover everything from payroll to the loans and leases, and to also go ahead and have what I need to take home.